The next time you go for a walk in the forest, remember this. You can experience the powerful benefits and healing properties of forest bathing. I just learned about forest bathing last year from a friend. I was more intrigued by the term rather than the actual practice, because to me, there's nothing new about walking in a forest. So I did a deep dive and discovered an even more interesting term, Shinrin-Yoku. The term originated in Japan in 1982. Shinrin means forest, Yoku means bath. Shinrin-Yoku is the Japanese practice of immersing yourself in the forest, experiencing it through all your senses. It's about being mindful, present, connecting with nature, and experiencing the physical and emotional health benefits. Research studies have shown the health benefits include decreased blood pressure and cortisol levels, increased relaxation response, and increased immune system. We know that the simple practice of forest bathing has significant physical and mental health benefits. But what are the implications for stroke survivors? I recently came across a study published in Korea last year in 2024 called The Impact of Forest Therapy on Functional Recovery After Acute Ischemic Stroke. According to this study, stroke is a leading cause of death and disability, but the World Health Organization forecasts that the burden of stroke will increase by 50% over the next 30 years. For this reason, stroke prevention and effective rehab for survivors is increasingly important. Many studies have examined the benefits of forest therapy and its impact on depression, anxiety, pain, and cardiovascular issues. However, this is the very first study to examine the direct impact of forest therapy on stroke rehabilitation. The purpose of this study is to determine whether forest therapy can increase functional recovery in patients with acute ischemic stroke. This study examined 44 ischemic stroke survivors between the ages of 50 to 75. They were split into a forest therapy group and a control group. The first group began forest therapy 1 week after hospital discharge with 5 sessions of guided activities. Each visit involved a 2-day, 1-night stay in the forest center consisting of recreational activities such as stretching, walking, and various meditation activities. The control group participated in standard outpatient rehab 2 times per week and received physical and occupational therapy. Both groups had lab tests and questionnaires conducted before and after each visit. The forest therapy group demonstrated significant improvement in functional outcomes compared to the control group at the 3-month follow-up. Furthermore, this group had reduced depression, anger, and other mental health issues common in stroke survivors. The results suggest that integrating forest therapy in stroke rehabilitation enhances emotional well-being and physical recovery. So this is why we intentionally spend time in nature every chance we get. This is why we Shinrin-Yoku.